Good morning.
This is Our Heart of Hearts. I'm Josh Chapman.
I'm Aaliyah Hicks.
I'm Ria Pradeep.
And I'm Skylar Mattel. So, how would a person's life be affected once they learn that they have a life-threatening condition? In order to choose a patient, we made a criteria with these 3 points. The patient had to be in good health, they had to be able to afford the procedure, as well as having a goal or family responsibility after the procedure.
So one of the main criteria we want to be looking at is the health of our patients. The person's health choices that they have made throughout their lives are extremely crucial when discussing whether or not they should be given a second chance to live. It is very important for us as doctors to identify and discuss any previous bad habits that could cause health complications. We also want to look at the age of given patients and any additional health issues that they may have afterwards. One of the main things we want to look at is if they have consumed large amounts of alcohol or been smoking cigarettes for a long time. Alcohol contributes to obesity, high blood pressure, and stroke, all of which put an immense amount of strain on the heart, which can lead to being very unhealthy and eventually leading it to fail. Smoking can also cause damage to heart muscle that is manifested as many different types of abnormalities that can harm the function of the heart and make it a lot weaker. We also would like to look at the age, as older age inevitably leads to other organs failing and needing to be replaced as well as us being able to focus in on younger people as they will have more time to live and with us be better suited to obtain a new heart. We also want to look at any pre-existing complications, see if any patients have unidentified health issues that could conflict with the heart transplant, or see if any of the previous bad habits like alcohol and smoking will in turn lead to other organ failure that could cause complications and eventually lead to them needing more other organs, which would be unfair as we could just split them and save more people.
The second criteria we use in deciding who will be the patient that gets the heart transplant was whether or not they were able to financially afford the procedure. As we see here, a person's economic status severely affects their ability to financially bounce back after the procedure. The cost of the procedure costs a lot, and the cost of medications that come with it afterward also costs a lot. As shown by our evidence, high out-of-pocket expense has the potential to impact patient compliance, whereby families must choose between life-saving medications and other necessities. So if a patient cannot afford to financially afford the cost of the procedure and the medications, they may risk not being able to afford the life-saving necessities that they need for everyday life. 2 factors that were taken into consideration while we were choosing the patient were the type of insurance that they have and whether or not they will be able to afford the cost of the procedure. As shown by our chart here, patients with private insurance had a 9% chance of dying while on the wait list, while patients with government insurance or Medicaid had 11% chance of dying on the wait list. So being able to afford private insurance increases a person's likelihood of survival while waiting for a heart transplant.
Our third claim is goals and responsibilities for the procedure. A question we have to ask ourselves is this person going to help other people's lives and better themselves in the process? Here we have a chart which shows 3 groups that are most likely to accept heart transplants if they had to. So that's cardiac physicians, such as cardiologists or heart failure specialists with 85% just accepting, and then there's pediatric cardiac nurses with 71% just accepting. We have parents with 64%. Focusing more on the parents, being a provider and being a parent comes with responsibilities. And how responsibilities, you want to stay present for your family and live out the rest of your life with your loved ones. We also have a quote. Without the pain, I never fully knew the gift of life. My story and the ultimate gift of organ transplants give me a second chance to live. But more importantly, it taught me the true meaning of love and sacrifice. To dive deeper into this, it shows that this person wants to live out or have second chance at life to live out with the rest of their family. And this also shows that they prioritize their health, and this is a good example for their family and shows the importance of resilience and self-care. Not only does it set an example for their family, it's an example for the people around them as well as they face these hardships with grace and they appreciate their lives.
So why didn't we choose person A and B? Well, candidate A had alcoholism in the past, and we don't want to risk them getting back on alcohol after the procedure. They also don't currently have a job, so it's unknown whether or not they are able to financially afford the procedure. Candidate B has smoked in the past, so there's probably damage in his organs, as well as him not meeting the financial requirements. He's also quite old compared to the other candidates.
We also did not pick person C and E. Person C smokes and drinks regularly, and having such bad habits like this, especially in her case where they were so severe, there is a high chance in the future that if she were to get a heart transplant, she would end up relapsing back onto these bad habits. And having a heart transplant and smoking a pack a day and drinking regularly can cause complications. She was also always working with 80-hour hectic weeks, and working that much will obviously come with a lot of stress. And having a heart transplant and having an untrusting heart can cause complications as well. She also did not spend any time with her family, so hypothetically speaking, if things were to happen to her in the future, she would have no one by her side. And family also brings comfort to a person when they go under a serious surgery like this. We did not pick person E because she did not meet the financial requirements. She had no type of health or medical insurance. She was also unhoused. With having unhoused, you need to have a stable environment in order to undergo surgeries like this. She also had no family, and for the same reason as person C, she wouldn't have anyone by her side if anything were to happen to her hypothetically in the future.
So why did we pick person D? Person D meets all three of our criteria. For starters, he meets our financial criteria. Person D has a stable job and is provided insurance by his company, meaning that he will be able to afford the cost of the procedure and the cost of medications that come with it afterward. Secondly, person D has a goal for his life after the procedure. He has 3 children who he would love to be a part of. And with his new heart, he would be able to be a part of his children's lives and live a good life. In addition to this, person D has never been in trouble with the law. So we know that once person D gets his heart, he will be a law-abiding citizen and spend the rest of his life with his family. In addition to this, person D does not smoke or drink. So we know that he will not have any health complications due to smoking and drinking. And we know that after he gets his heart, there will be a less risk of the heart being damaged due to him smoking and drinking.
Thank you.